If you're non-binary, or you think you might be, and you're experiencing body dysphoria, but here's what making this impossible. Most of the resources about body dysphoria assumes you want to look like a man or you want to look like a woman. The articles, the Reddit threads, the YouTube videos, a lot of them are typically talking about binary transitions. And you're sitting there thinking, but I don't want to be a man and I don't want to be a woman. So, what am I supposed to do with all of these feelings? Hi, I'm Dr. Z. I'm a clinical psychologist who, for the past 20 years, focused exclusively working with transgender and non binary adults. And today, we're talking about something that gets discussed far too rarely, the specific ways body dysphoria shows up for non binary people and why it's so much harder to navigate than most people acknowledge. Make sure you watch the entire video because I will share with you 4 important questions for you to explore as you navigate non-binary transition. So let's get started. Here's what I see happening in my practice constantly. Maybe you look at your chest and you don't want breasts, but you also don't want a completely flat masculine chest. You want something else, something in between, something that doesn't have a name or a surgical standard. And when you try research what's possible, you find top surgery results for trans men, or maybe breast augmentation for trans women, and very little for what you're looking for. And currently, there's still very few surgeons who offer non-binary surgical options. Or maybe it's your face. You look in the mirror and you see features that code as too feminine or too masculine. But here's where it gets a little bit complicated. The features that bother you aren't the same features that bother binary trans people. A trans woman might look at her jawline and want it softer, for example. A trans man, for example, might look at his jawline and want it more angular. But some of you might look at your jawline and think, I don't want masculine. I also don't want feminine. I want neither, both, something completely else. And you can't exactly Google gender neutral jawline surgery because that's not even a thing that most medical providers are set up to understand or even deliver. Here's another version I see frequently. Maybe you're assigned female at birth and you've been on testosterone. Your voice has dropped. Maybe you grew facial hair. Your body composition changed. And some of that feels right. Finally, like, yes, this is more me. But then other parts feel like you're overcorrected, like you traded one wrong body for a different wrong body. You wanted to move away from woman, but you didn't want to land at a man. You wanted to land somewhere else, somewhere that doesn't exist in most medical transition playbooks. Or maybe you haven't medical transition at all, and you're stuck in this impossible place where you experience body dysphoria, real, clinical, significant body dysphoria, but you don't want the standard solutions. You look at your body and you feel discomfort, the wrongness, that sense of this doesn't fit. But when you research what to do about it, most pathways assume a binary destination. Top surgery? Great. Do you want a masculine chest or a feminine chest? Hormone therapy? Wonderful. Do you want to masculinize or do you want to feminize? And you're sitting there thinking, neither. I want to androgynize. I want to neutralize. I want to become less gendered, not differently gendered. So why is this so complicated? Well, first of all, medical transition was largely designed for binary outcomes. And I don't really say this to criticize the medical system. I say it because it's just factually true. The frameworks, the protocols, the surgical techniques, even the hormone regimens, they were developed with the assumption that a person is moving from one binary gender to another. That means when you're non-binary and you're trying to figure out what to do with body dysphoria, you're trying to use tools that weren't built for what you're trying to build. It's like trying to paint a specific color when you only have red paint and blue paint. Now you can mix them together and get purple. But what if you don't want purple? What if you want green? The tools you have access to can't produce the outcome you're looking for. Secondly, your dysphoria might not be about having the wrong features. It might be about those features being read wrong. Now, let me explain what I mean. Maybe your body doesn't bother you when you're alone. Maybe you look at your chest or your face or your build and think, this is fine, this is me. But then you go out in public and people see those features and instantly categorize you, sir or ma'am, he or she. And suddenly, those same features that felt okay in private become unbearable in public because of what they signal to other people. The dysphoria isn't about your body, it's about being misread. And in this context, it becomes a socially driven dysphoria versus a physically driven dysphoria. That's completely different kind of dysphoria than I have the wrong body parts. That is, I have body parts that communicate the wrong information about who I am, and I can't control how people interpret them. And here's what makes that particular hard. Changing your body might not actually fix it. Because the problem isn't entirely about your body. The problem is about living in a world that mostly has two categories and will tend to force you into one of them regardless of what you do. Thirdly, and this is where it gets really messy, you might have some binary dysphoria and some non-binary dysphoria at the same time. For example, maybe you look at your chest and you want it flat, clear binary goal. But you look at your face and you don't want a masculine face or a feminine face, non-binary goal. So now what? You pursue top surgery, which is relatively straightforward, but facial changes, those might masculinize you in ways you don't want while you're trying to address features that feel too feminine. You're trying to navigate multiple, sometimes contradictory goals with tools that assume you only have one goal. And fourth, the feedback you need to make decisions often doesn't exist. When binary trans people consider medical transition, they can often find people who transitioned in similar ways. They can see before and after photos. They can ask, what was it like? Do you have regrets? What changed? But for non-binary transitions, especially ones that are trying to achieve androgyny or gender neutrality, the roadmap is much thinner. It's not impossible. It's not that it's not there, but it's not as abundant as it is for trans-binary people. There are fewer people doing it, fewer surgeons who understand what you're asking for, fewer examples to reference. And therefore, you're making decisions about permanent body modifications without being able to clearly see what the outcome might look like or how it might feel. After working with many clients, I can tell you this. This is one of the most challenging aspects of non-binary gender dysphoria. You're navigating body changes with limited information, limited medical expertise, and limited cultural understanding of what you've even trying to achieve. I'm not going to tell you what to do with your dysphoria, and I can't really tell you to this educational video what to do with your dysphoria. But I'm going to give you 4 questions that are worth examining. 4 questions that I found really helpful for people to sit with. Question number 1. When you imagine your body changing, what are you moving toward? Not away from, but toward. Can you describe what you imagine moving toward to? Does it have a name? Does it exist in a world today? Question number 2. Is your dysphoria about your body itself or about how your body gets read by others? If people could see you exactly as you are, non-binary, neither, both, something else, would the physical features still bother you? Question number 3. By the way, if by now you find this video helpful and useful, please give it thumbs up, subscribe if you don't yet already, and comment below if you can. Question number 3. If you could have any body modifications, but they came with zero social recognition or understanding, meaning people still wouldn't really understand your gender, would you still want them? Now, that question can tell you something about whether the dysphoria is primarily internal or primarily social. There's no right answer. Both are very valid, but knowing which, at least knowing which one you're dealing with, actually matters and can really help you. So here's one more question. Question number 4. What are you most afraid of? Are you more afraid of changing your body and still not feeling right? Or not changing your body and wondering what if for the rest of your life? Now, you don't have to answer this right now. None of these questions demand answers right now. But just notice what comes up when you ask yourself. If this is what you're experiencing, I want you to know something. This is exhausting. Living with body dysphoria is hard enough when there's a clear pathway forward. Now, living with it when the pathway doesn't exist yet, when you're having to advocate for modification that providers don't fully understand, when you can't even fully find language for what you're trying to achieve, now that's exponentially harder. The fact that this is difficult doesn't mean you're doing it wrong. It means you're trying to navigate something that medical and social systems are not set up to support yet. Now, you're not confused, you're not indecisive, you're dealing with body dysphoria that doesn't fit the binary frameworks most people are using. And you're doing it with very limited resources, limited medical understanding, and limited cultural recognition of what you're experiencing. In my clinical assessments with clients, one of the things I specifically evaluate is the relationship between someone's gender identity and their body dysphoria. Again, relationship between somebody's gender identity and their body dysphoria. And I can tell you, non-binary body dysphoria is absolutely clinically real. It is clinically significant, and it is equally complex in ways that are distinct from binary dysphoria. This isn't dysphoria light. This isn't non-existent dysphoria, and this isn't not sure yet. This is its own thing with its own challenges. And the fact that it's harder to navigate doesn't make it less valid. It makes it harder to navigate, period. So if you're non-binary and you're experiencing body dysphoria, and you're finding that nothing quite fits what you're looking for, you're definitely not alone. This is very complex. Not because something's wrong with you, but because you're trying to again address something that medical systems and social frameworks aren't fully equipped to understand, at least not yet. The tools that definitely exist for binary transitions. The tools for non-binary transitions, especially ones aimed at androgyny or gender neutrality, are still being developed. And you're navigating that gap in real time in your own body. And that's what makes it difficult. And that's hard. It's really hard. And you're doing it anyway. So if you're experiencing what I described today, know that it is real, it is difficult, and it is challenging. Comment below and share your experiences. And if this video was again helpful, please like, subscribe, and I will see you all next week. Goodbye.